Thanks, Judy. Hi, guys. I'm Dr. James Sullivan, and despite what Judy says, if you want to applaud during my presentation, that's A-okay. So I'm a family medicine physician here in Nebraska. I want to talk to you today about a medication that you guys probably haven't seen a whole lot of up to this point come across your desks, but you're going to see a lot more of it. That is Narcan or Naloxone. This is a medication that reverses the effects of opioids. So think of it as an emergent medication, kind of like an EpiPen. So it's a rare medication that what we're used to, but we're going to see it a whole lot more in the coming years. Okay. Sorry. Did I go the wrong way?
I don't know what happened.
I don't either.
Is it not in the right order?
No.
Okay, keep
That's
going.
okay.
Keep going. There, real life patients was at the end. Now,
That
can
was
you go
supposed to
back
be
one?
second.
I know.
Yeah.
There you go. Whoops. There you go.
Okay.
Go way to the end.
That's okay.
There.
Okay. So, literally not 2 weeks ago, I was working in an emergency room in western Nebraska, small town. I cover emergency rooms on occasion. And I had 2 patients in the same weekend, literally on a Saturday. 2 young males in their 30s came into the ER in an emergent state. Both of them were not breathing. One of them, CPR was being initiated at the time they came in. When they came in, I needed to intubate both of them because they were not breathing. But interestingly, their hearts were still beating, so that was very odd. The only thing that was going on is they were unconscious and they were not breathing. So that's pretty rare condition. Usually you kind of get an idea why people aren't breathing. You can direct your treatment that way. So the first thing I thought, these are healthy young males. I'm going to give them Narcan to see what happens. Narcan is a safe enough drug that just in case they might be having an opioid overdose. So I gave them Narcan, and it was extremely dramatic what happened. Both patients woke up within seconds. They woke, it was very dramatic. Actually, one of them sat straight up and pulled the tube right out of his mouth because he was like, what is going on? So further history, I'm like, well, what's going on with these guys? Both of these guys were doing cocaine. So Narcan will not do anything to a cocaine overdose. Cocaine's a stimulant, so that medication would have no effects. What I found out later from local law enforcement was the cocaine these guys were getting was laced with fentanyl. So fentanyl's an opioid. So very dramatic effects of what Narcan can do. Okay, the reason I'm talking about this is there's an opioid crisis in our country. Opioids being heroin, fentanyl, morphine, oxycodone, hydrocodone, codeine, tramadol. As you can see on that list, only one of those, heroin, is illegal. All these other drugs are prescribed drugs that I prescribe routinely. Nearly 50,000 people died of opioid overdoses in 2019. That's way too many people. So patients who are prescribed opioids, of all the patients prescribed opioids, up to 30% of them misuse them. 12% of those patients that use opioids for chronic pain develop an opioid use disorder, or they're addicted to them. And unfortunately, 6% of those people move on into heroin. So for this reason, federal government, state government, CDC has put out strict prescribing guidelines. So gone are the days of me writing a prescription for 240 Percocet a month for people who have arthritis. Can't do that anymore. So there are strict statutes now that have just come out that give us guidelines on how to prescribe opioids, especially for chronic treatment, not just, hey, you broke your ankle, here's a 7-day prescription for Percocet for pain control. This is the chronic pain people. Part of these guidelines would be I must see these people every 2 months in clinic face-to-face to make sure they're using them properly and it's working. I need to drug test them at least twice a year, and Naloxone prescriptions are part of these guidelines. So what is Naloxone or Narcan? It's an opioid antagonist, meaning Naloxone binds to opioid receptors in the central nervous system and blocks their effects. When people take opioids, part of the mechanism of action is it decreases your respiratory drive. So you take fentanyl or Percocet, any of these meds, your breathing slows down. If you take enough of a dose, your breathing will slow down to the point of an emergency situation. So opioid overdoses, the problem is when you get addicted to opioids, you need to take more and more and more and more to get the same effects. So their overdose is very easy to do. So when you have an opioid overdose, the main problem is you stop breathing. So Naloxone treatment can be a life-saving treatment, similar to like an EpiPen. If you get a bee sting, you get into anaphylaxis, you give it an EpiPen, and you can save a life. So Naloxone comes in different forms. I think the most common form that you'll see across when you fill prescriptions will be the intranasal spray. It also comes intramuscularly and in an IV form. These are the forms we'll use in the emergency room setting, most likely, or hospital setting. Law enforcement people carry these. First responders carries this. Here's the caveat with using Naloxone. It has a very, very short half-life. So you can give a dose. If you don't get a response, you can repeat that dose every 2 to 3 minutes till you do get a response. But word of caution, so you say you're a family member and you discover your loved one had an opioid overdose and you give them Naloxone and they wake up, great. But you need to get them to the emergency room immediately because the effects of Naloxone will wear off. So it only lasts about 60 to 90 minutes. So it's very critical because that opioid is still in their system. So once Naloxone wears off, and I've seen this, you wake that patient up, all is well, and an hour later, they're back to not breathing. So usually you need to admit these patients to the hospital, and you can do a Narcan drip, an IV intravenous drip to keep blocking the effects of the opioids. So here's what a typical Narcan prescription looks like. It's an intranasal spray. They'll come in 2 in a box for that repeat second dose. Usually, they won't give you more than that because if you're given 3, 4, 5 doses, you should be calling 911 and you should be in an emergency setting. So this is probably the most common form that you guys will be seeing come across your desks in your retail pharmacies. So, all right. Thank you.